work of Doctors Without Borders is guided by three important humanitarian principles: neutrality, impartiality, and independence. But what exactly do we mean when we say our work is neutral, impartial, and independent? Well, being neutral means that we don't take sides in a conflict. We only care about saving lives and alleviating human suffering. Being impartial means helping people according to their medical needs and giving medical care regardless of a person's race, religion, gender, political views, or any other affiliation. And thanks to the support we receive from donors around the world, we can also remain independent. Our independence allows us to reach the people who need our help the most. Living up to these principles is essential to our work. Without these principles, we wouldn't be able to gain the trust and acceptance of all sides in the places where we work. But sometimes living up to our principles is also difficult. For example, during the Rwandan genocide, we made the difficult choice of calling for the military to stop the genocide. This decision made it seem like we were taking sides in the war. In this case, calling for military intervention was a last resort to stop the genocide, despite our principle of neutrality. That's because we will also speak out when we see atrocities against populations or deliberate attacks on people. Just as being impartial is not the same as choosing to be overly accommodating, we will treat anyone who needs medical care, but we will also hold governments accountable to their responsibilities to care for their populations in need. To learn how you can help support neutral, independent, and impartial humanitarian medical care, follow the link in the video description.
Hi, everybody. Welcome to our event, The Principles of Independence, Providing Care Based on Need. My name is Dr. Wendy Lai, and I'm the president of the board of directors of Doctors Without Borders, also called Médecins Sans Frontières Canada, or MSF Canada, and you'll hear me use that acronym a lot. I'm joined today by my colleague Trisha Khan, who will arrive in a moment. She's a field worker and MSF Canada's donor engagement officer for Western Canada. And we're going to be having a conversation about the principle of independence and why it's at the core of who we are. Hi, Trisha.
Hi, Wendy. How are you?
I'm fine, thank you. So for those of you who don't know, Doctors Without Borders, or Médecins Sans Frontières, also called MSF, is an international Nobel Prize-winning medical humanitarian organization. We provide emergency medical care to people affected by disaster, conflict, epidemics, and those excluded from healthcare. At the core of our identity is a strong commitment to humanitarian principles of independence, neutrality, and impartiality, and this is what was just in the video. So for all of you who are out there, thanks for coming. Please feel free to ask questions, comment, share so that others can join. And, you know, we're going to carry on with our discussion here. And independence, so there's a few kind of related things here related to our core principles. So independence is about the fact that we rely on private donations, mostly from individual members of the public. So this is a financial independence, meaning that the aid that we provide is based on our medical assessment, independent of any political pressure or agenda. Impartiality refers to the fact that we offer free medical care to people who need it, regardless of which country they're in or from, what religion they follow, or what their political affiliation might be. All that matters is that they're human beings in need. And neutrality means that we do not take sides in conflict situations. We really focus on saving lives and alleviating suffering where people's medical needs are the greatest. And to add to those three, remember also as a medical organization, we're guided by our medical professional ethics in that our actions are first and foremost medical. What we're trying to do is provide quality care for individual patients, and that's the center of our humanitarian objectives. So I'm going to get going with our discussion with Trisha, and as I said, please feel free to ask your questions, and we'll try to respond as they come along. But Trisha, why don't you tell us a little bit about yourself and why you started working for MSF?
Sure. Well, first of all, I'm very, very happy to be here. Very excited to be having this conversation. I think talking about our principles really reminds me actually of why I started with MSF in the first place. I find like the principles impartiality, neutrality, independence, they all resonate very strongly with me. They firmly align with my values, but I think the one that stands out the most to me is actually independence, because I believe that the fact that we rely 90 to 95% of our funding comes from individuals, it means that we're able to make decisions based solely on need, and we're not tied to any other influencers in that sense. And so we are really able to adjust based on the needs of the community and keeping the community at the center of our responses. And to me, I believe that everyone should have access to quality medical care. And so that's really what inspired me to start with MSF. I started 5 years ago, and I've worked in different positions, always having to do something with engagement. So within the fundraising team, I work as a donor engagement officer. I've worked as public engagement officer, and then in the field as in a position that's called health promotion and community engagement.
Thanks, Trisha. Do you want to start maybe by talking about how it is that you engage with communities when you're in the field, and specifically how you talk to communities about this principle of independence? And I'm curious to hear a bit about, how it's received, how challenging it is to talk about that concept with a whole variety of people across the world.
Yeah, sure. I think it is really interesting, because I think when we talk about independence, when I talk about that here with public in Canada, the conversation is usually about the fact that our independent funding allows us to have this ability to respond to in the field. And so I think that people really understand what that allows for us. And when we're in our projects, it's very similar. I think that people understand that because MSF doesn't have influence from outside actors, because of this financial independence, it very clearly means that we can engage in ways that keeps the community at the center, and we can have discussions on how exactly we need to shape our programming in order to make sure that the community is at the center. And so whether that has to do with providing medical care or our advocacy efforts, whatever that is, we're able to approach it from a perspective of coming to sit down at the table and to have a conversation and to work together to be able to figure out what is the best way forward for that particular community. And so I find like the teams that I've worked with in the projects where I've been, it's, you learn so much every time you have a conversation with either the staff that you're working with or the community that you're engaging with. And it really helps you to understand, okay, so independence is something that means that we are going to shape based on needs, and how best can we understand the needs of that community and the needs of our staff and the needs of our patients, and then shape what it is that we're doing for our response. Hope that's a clear answer.
Yeah, it is. Thank you. And I think that's really crucial, that it is really about, the conversations that we're having on the ground, and how different people on the ground are seeing what's happening there, and what's going to be the most useful for them, who are situated right there and who understand that context the best, rather than being driven, from another place.
Yeah, exactly.
I want to welcome people who are watching. Apparently there are people who have joined us from Cuba, from Canada, from South Africa, Somaliland, and the United Kingdom. I think that's a great collection of places. So welcome and thank you. And if you've just joined us, please do feel free to comment and share as well the link. And I will reintroduce myself. My name is Dr. Wendy Lai. I'm the president of the board of directors of Doctors Without Borders, or Médecins Sans Frontières Canada. And I'm joined by Trisha Khan, who's both a field worker and our donor engagement officer for Western Canada. Looks like there's a question from the audience. And let me see here. Which is actually a really good one. So how does MSF reflect on the principles internally? How do we have these discussions with our colleagues? Want to take that up?
Sure. Yeah, I'll start. And yeah, I'm interested to hear your view on this as well. So MSF, we actually refer to ourselves as a movement. And what that means is we are made up not just of the different offices that exist around the world, but everyone who's been a staff member for MSF is a part of what we call our association. And every year, the association holds assemblies within their own countries. In some places where we have projects as well, we have what we call the field associated debate. And so this is where the staff that work for MSF get together and they discuss issues that are important to MSF. And so, for example, while the discussions about Black Lives Matter is a very important conversation that's happening, it's also sparked a lot of conversations within MSF. And so we use that platform, our association, to be able to have these conversations and make sure that we have input from really, really diverse groups of people. So we're making sure that everyone has the ability to have access in whatever ways we can. And if that's not possible, that we're pushing for that to be possible, because we are a movement made up of individuals, and together we're stronger when we have many voices that represent it.
And I'd agree with that. I think we are, absolutely, we're a movement of individuals, many of whom have very strong opinions, and we like to discuss things. And actually, I think it's great that we're talking about principles today, because frankly, that discussion it never gets old. Even though the concepts are foundational to the organization, which has been around now nearly for 50 years. They're foundational, they're absolutely integral to who we are. And yet we're also always, I think, talking about really, what does it mean, or are we doing it properly, or, what does it mean for a particular situation? And I think that's true both, in some of the places that we work in the field where we're confronted with a particular interaction with other actors, whether it's government or other NGOs or, some of the UN bodies. And, we talk about that a lot here at home in Canada as well. I think where I'm going to go next is to say, well, we want to hear, Trisha, about some of the work that you've done, and curious to see or to hear about how this concept of independence, what that means in real terms. So I thought maybe you could talk about your time in Bangladesh and what you thought independence could or couldn't do for us, and how that impacted what we were working on while we were there.
Yeah, that's a great, I think that's actually a really great example as well. So MSF has been operational in Bangladesh since, I believe, the early 90s. We were also operational in Myanmar, and we chose to have projects in those two places because we recognized the extreme vulnerability of the Rohingya population. In August 2017, when the Myanmar army launched the attacks against the Rohingya population, we saw this mass exodus of people. So this was a population the size of the town that I grew up in. It's about 800,000 people. And this all happened over the course of a couple of weeks. And so at the time, MSF was running one health center. And based on the massive influx of people that were coming into the refugee camps in the Cox's Bazar area, MSF was able to very, very quickly respond to both the short-term needs and the long-term needs. So because we didn't have to wait for any approvals of funding, or we didn't have any specific envelope of funding that was reserved specifically for a project within that country that wasn't pliable and that we were able to use to adjust our programming, MSF was able to start building additional health centers. We were able to start doing outreach work and installing health posts all across the camp. We were also able to focus on our témoignage, or advocacy, so making sure that the voices of were being heard. And at the same time, have a long-term view of preparing for what was to come. So we're building more permanent health structures, and at the same time laying a pipeline across the entire length of the mega camp to ensure that there weren't just latrines and hand pumps, but that there was a sustainable water source across the length of the camp. And so I think this is a really good example of the fact that because we have independent donations that are coming from our supporters worldwide, we're able to really quickly make decisions based on the absolute need in that moment, and we're able to adjust that constantly based on what's happening. And so, I'm always really thankful for the trust that we have from supporters, and that they are allowing us to make those decisions based solely on need, and that we're not tied to any other agenda.
Thanks, Trisha. And I remember that moment when there was this massive movement of people from Myanmar into Bangladesh, and just in terms of how kind of rapidly that happened, and of course the number of people who were coming across, and the many needs that they had. already dealing with that is challenging enough, and that independence that really allows us this responsiveness and flexibility in terms of the kinds of activities that we're able to do in a way that that facilitates what is already a challenging job, right? So in that sense, for teams on the ground, I think it's probably quite a relief to kind of not have to fuss that much with like worrying about where the resources are coming from, because they already have all of these other things that they're planning, right? Building health structures and figuring out the water supply, et cetera. And in a way that reminds me a lot of Haiti, which is a context I'm quite familiar with. I was in Haiti before the earthquake in 2010 when we were doing emergency obstetrics. So we had quite a well-developed and very busy obstetrics program there. And then yet when the earthquake happened, suddenly it was this like really rapid, the needs were suddenly very different, very acute, lots of volume and lots of challenge logistically as well in terms of getting in the right kind of personnel and the right kind of materials and being able to do this kind of rapid shift of going like, the obstetrics thing was on hold at that moment, and to saying like, how do we do the trauma care and the orthopedics care that we need to do post-earthquake, and that kind of shifting a program is really helpful to us because, of course, things on the ground change extremely quickly. I think, hang on, I'm gonna reintroduce myself for people who are just joining us. My name is Dr. Wendy Lai, the president of the board of directors of MSF Canada, also known as Médecins Sans Frontières, or Doctors Without Borders. I'm joined by Trisha Khan, who's a field worker, as well as the donor engagement officer for Western Canada. Trisha's worked in Bangladesh as well as in South Sudan. And I've done a number of missions, several in Haiti, as well as Democratic Republic of Congo and the Central African Republic. If you've just joined us, please feel free to send in your questions or comments, or just say hello, and also remember to share the link with friends. Here's a question from Bahara. When you decide to start a mission in a country, especially in places dealing with internal or external conflicts, what steps do you usually take to convince the government of that country that you are an independent organization and not connected to any sides or any external parties? That's a great question. Want to start on that, and we'll go together.
Yeah, sure. That's a great question. Thank you for that. Yeah, and I mean, just to start off by saying that, there's no one size fits all, is that there definitely is going to be different things needed depending on where you're working. So I think one thing that is really important is that MSF keeps its transparency as a priority. And so that's our transparency in terms of where our funding comes from, and the places in which we operate. And so we make sure and we do that through our impact report, which happens annually, and then constant reporting that happens. And so that's one way that governments themselves are able to go onto our website and see that, and there's transparency behind that. But entering into a response, one of the most important things is that MSF will always have conversations with all sides who are party to a conflict. And there needs to be an understanding that is reached, that MSF is seen as a neutral, independent party, and that our protection is guaranteed in terms of that a hospital and the civilians and the patients that are within it are not going to be associated with any one side. And so we do a lot to try to ensure that we stay true to that, in terms of having constant conversations with the different parties, making sure that we're engaging with the community, and that also we're being really careful about what the needs are for all sides. And so making sure that the access to healthcare is accessible by whoever needs it, and it does not matter which party they may or may not be affiliated to. Once they enter into the hospital, they are a patient, and that is the first and foremost.
Thanks, Trish. I think you're exactly right. A lot of what we do when we're organizing in a place, whether we're just setting up or whether we've been there for a long time and are continuing to maintain our relationships with government authorities and anyone else who's active in a particular place, is a lot about talking about this. This is why it's so fundamental. It's why we talk about it all the time as well to each other, of saying, like, this is what this organization is about. This is what we're found. These are the principles that we're founded on, and then being able to demonstrate, right? And in terms of, as you say, like, where does our funding come from, and being able to demonstrate that. So if people decide they're going to do a full long check of where the funding comes from, that is also very evident. And we're, every context is a little bit different, right? So there are some in which we have to be extremely meticulous in terms of, as much transparency as possible, because they're such sensitive places. And frankly, those places are more and more in the world. And there's a follow-up question from Borchu. How does MSF liaise with non-independent organizations? That's a good kind of continuation.
Non-independent organizations. What do you interpret from that, Wendy, just so I make sure that I understand it?
I think there's a few ways maybe to interpret this. I mean, we talk to, so if we're in a conflict area, for example, I mean, I want to get to South Sudan in a moment, but in conflict areas like South Sudan, obviously, in order to be able to function in an area, we're also in regular contact with actual parties to the conflict. And then in other contexts as well, and I'm not sure if this was the case in Bangladesh, but often we're working in partnership or collaboration with organizations, either other international NGOs, often local ministries of health, sometimes local NGOs as well, and that interaction with them.
Okay. It's a great question. So I think I can use South Sudan as an example. So while I was in South Sudan, and this is just a bit of a trigger warning because I'm going to be talking about sexual violence, but I was in a part of the country where there was the need to cross front lines for some of the population coming in and out of the main town centers. The UN was doing food drops from this town where we were based, and at a certain moment in time, a peace agreement was signed, and when the peace agreement was signed, there was a sudden increase in violence that was happening in the area. Quite often when a food drop happens, it's women and children who are making the trek to get the supplies. And so as the food drop was starting, we started to see more and more survivors coming to our facility for care. The numbers were increasing day after day, and MSF needed to liaise very, very quickly with the other organizations that were in the area. And so that was the UN, that was other organizations that were part of what we call the hub. So there was a sexual and gender-based violence hub that was put in place specifically to address this. And we also needed to have conversations with the different actors that were in the area to try to ensure that there was more safety measures that were put in place to protect people as they were walking from outside of the community into the center. And so that's a really important part of what happens, is talking with both, first of all, the UN to try to decentralize the food drops so that people didn't have to walk as far and they weren't having to cross front lines. Also negotiating with the different actors that were in the area to ensure that there was protection for people who were out walking. And then as a last resort, also a really important part of the work that MSF does is advocacy. And so we had to make a decision about whether or not we were going to speak out about what was happening. And so MSF did actually decide to make a press release about what was happening to try to push for action to happen really quickly. And so I think this is a really good example of a moment in time where MSF, not being tied to outside influences, were able to act very quickly to make that decision to speak out about what was happening so that we could try to push for change more rapidly and sort of bring attention to a situation that needed a really immediate action, as opposed to other organizations and parties that were in the area that were a bit more tied in terms of decision making and power structures, how that works to be able to act quickly. So yeah, I think that's one example I think I can give.
Thanks, Trisha. I want to come back to this concept of témoignage and advocacy in a moment. But in the meantime, I will say, for those of you just joining us, I will introduce myself. My name is Dr. Wendy Lai. I am the president of the board of directors of MSF Canada, also known as Doctors Without Borders, Médecins, sans Frontières. I've worked for Doctors Without Borders since 2006. I've done a number of missions in Haiti, as well as Democratic Republic of Congo, and the Central African Republic. Excuse me. I'm joined today by Trisha Khan, who is both a field worker, and we were just talking about South Sudan. She's both a field worker and is currently the donor engagement officer for Western Canada. And we're talking today about one of our foundational principles, which is that of independence. Again, if you're just joining us, please feel free to post your questions, and we'd be happy to try to take them on. There have been some really good ones here today, or comments, and share also, please, with your friends. We were just talking about this idea of speaking out, right? Of sort of saying, so you were saying, Trish, in South Sudan, when the situation changed such that there was suddenly this much higher level of what we were seeing in our clinics of sexual violence, and the decision that we made to speak about that publicly. And to me, though, that goes very clearly with this idea of independence. This was brought up also in the video that we showed at the beginning here, where on a number of occasions, for example, relatively recently with West African Ebola, when Dr. Liu was talking to the Security Council, and frankly also from the beginning. So when we talk about this decision around advocacy, in the conversations, for example, that you guys were having in South Sudan, how hard is that? Like, how do you kind of work through that trade-off, decide what the other options are? I mean, so independence means that we don't necessarily have someone else muzzling us, and as you know, we take that very proudly, but we also don't do that in every single situation. You want to talk about that a bit more?
Sure. Yeah. I mean, I think it's such a complicated conversation. I think, again, there's never one size that fits all. I think that every time there's a decision to speak out about something that is happening, there's always the consequences of what that could lead to, but also what can happen in terms of it being a catalyst for change, right? And so I think it's definitely a conversation that has to be weighed in terms of what are the long-term impacts. And so does this mean that there's going to be a change in the access that MSF has to providing care to a certain population, which I think is one of the most important considerations. Speaking out can sometimes mean that then you no longer are welcome to be in that certain place, right? And so I think that there's always a really fine line in terms of how you make those decisions, and they're never taken lightly. And I think that it's definitely something that every time it happens, we have the ability to learn from it. There's going to be people within MSF itself, I think, that will debate till the cows come home a lot of the decisions that have happened in the past. And I think it's important to have those conversations, because it's important to reflect on what happened in the moment and also to see how it affected us. In the example that I gave from South Sudan, there were repercussions for MSF in that area. And so there are things definitely that we learned from. And then there's also the direct impact that it had in that moment, making that decision. So, yeah, I think it's a super complicated conversation that takes so many different factors into consideration, and is something that should be a constant conversation. Even once it's happened, that's the end of it. I think it's really important to reflect on it and to be able to use that as a learning opportunity.
Yeah, I would agree. And, for me, I actually think of it similarly to the way that I make many medical decisions, which is there's a risk and a benefit to everything. And depending on what's going on the ground, is there going to be a greater benefit of speaking out about it, or is there going to be a greater risk? If we completely, for example, lose access to a particular community of people with very significant health needs, then actually maybe we think we can do more good, have more benefit from staying in a place. And then if we think we're being, utilized by saving lives and on a population who's otherwise being manipulated or kind of used as a pawn, then actually maybe speaking out would be better. And like everything, I mean, like giving whatever medication, you'll have to balance those two things. And we have to remember that it is one tool in our toolbox. But what I'm really happy about is that it is a tool that we have and that we can use when we feel that we need to, as opposed to, marching to someone else's orders.
Definitely.
So I'm going to introduce myself again. I think for those of you joining us, my name is Dr. Wendy Lai. I'm the president of the board of MSF Canada. And I'm speaking today with Trisha Khan, who's both a field worker and currently our donor engagement officer for Western Canada. And we're talking today about the principle of independence, one of our foundational principles of MSF. I'm gonna ask Trisha a little bit more, both about fundraising and this connection that that we have between donors and our patients and the communities that we work with, because we had a really interesting conversation yesterday about that linkage and that independence piece is actually in some ways that connection. You want to talk about that?
Sure. Yeah, definitely. So when I first started with MSF, I started in a fundraising capacity, and I, again, because MSF has 95% of our funding is coming from individuals, it's such an important part in making sure that we are able to serve our patients in the communities where we're working. And so I was always so fascinated at really making very clear to the people that I was having conversations with about that connection. And I really do view it as sort of a continuum, right? So we have the donors who are supporting us financially, and because of that financial independence, it gives us the ability to make those decisions in the projects where we're working that are based solely on need, right? And so I think it really, even though there might be these thousands and thousands of kilometers or miles that separate, I think that what both are doing is so closely connected. And I think it is really important that that our teams in the projects or in the communities where we're working are able to speak very freely about that independence when they're having conversations with community leaders, women's groups, youth groups, things like that, within their community, so that they understand that when they're having conversations, that they're talking about MSF as an organization that is keeping the community at the center, and that our supporters really understand that it is the because of the trust and the generosity that they have, that we're able to have those conversations and make sure that we stay true to that basing our actions on need.
Yeah, thank you. I'm going to welcome people who are joining us from Afghanistan, Bangladesh, Japan, Canada, the US, the United Kingdom, and Mexico. So hello and welcome to all of you, indeed, all over, including some countries we were just talking about. And to remind you, please do send your questions to us, and we'll try to we'll do our best to answer them. Some of them are, I have to say, quite challenging, but I totally appreciate the depth and nuance that everyone's bringing to this. And there's a question actually about this example that we were just talking about in South Sudan, because we were talking about a decision to speak out about the high volume of patients we were seeing who'd been victims of sexual violence. Let me see. Independence granted MSF the ability to freely advocate for its patients. When you make this decision that might limit access, can you talk about the relationship to another foundational principle, that of neutrality?
Right. Yes.
Yeah.
Oh, great hard-hitting question.
Exactly. You want to try to take that on?
No, but I mean, and just kind of returning to what I was saying before, I think it is a super important thing to keep top of mind. Like I said, these decisions are never taken lightly. The decision to speak out about what was happening in South Sudan was a very, very serious decision, and all of the implications that came with really had to be considered. So, I mean, in a place like South Sudan, in that example, because people were crossing front lines, when we're having discussions about what's happening in that moment, it's very important that MSF is speaking with all sides to the conflict. And so we're not saying it's one side of the party that we suspect is doing this, or it's not on the other side, is that we are speaking out based on facts, the things that we know for based on what we're seeing ourselves, and that we're not making any assumptions. And I think that that's one really important part when we talk about the neutrality, is that we're basing our speaking out on what we see, and that we're really keeping top of mind that unless we have a really, really clear statement that we can say about something, then we're not ever going to speculate. That's a really, really important part in keeping our neutrality. And it's something that I believe for the most part, MSF does really have that reputation in a lot of the places where we can work. And obviously, these statements are not all encompassing. They're not sweeping statements that cover everything. Like I said, I think there is a lot of nuances in terms of these decisions and how this works. And you could probably come up with examples where our neutrality would be pulled into question. And when you are speaking out about something, I think it is the case that will be an important consideration, and something that you do really have the ability to think about, to reflect on, and to make sure that as best as we can, that we are remaining neutral when we are speaking out, and when we are just as we are when we provide our care.
Thank you. I think that was great. I'm gonna add on a little bit to that. Before I do that, I will remind everyone, my name is Dr. Wendy Lai. I'm the president of the board of MSF Canada. I'm speaking with Trisha Khan, a field worker and our donor engagement officer for Western Canada. And we were just asked this really excellent question about kind of a tension between independence and the ability to advocate for our patients, and that the tension between that and another one of our foundational principles, which is neutrality. So just to make it super clear for everybody, to remind you about the differences between what are the foundational principles and the differences between them. I'll remind you that independence refers to the fact that our donations are in vast majority private donations from individual members of the public. So financial independence, which means that what we do is based on our assessment of what is needed medically. Impartiality refers to our decision of offering medical care for free to people who are in need of it, regardless of where they're from, what religion they follow, or any political affiliation, etc. Just that they are people who need medical care. And neutrality, meaning that we do not take sides in conflict situations. We're focused on our medical work, saving lives and alleviating suffering. And remembering as well that this is also our decisions are based on those of medical ethics, and the medical decisions that we're making in order to provide quality care to everybody who needs it. And so, I think for the person who asked this question, in terms of that balance between, and sometimes a balance between independence and our ability to speak out, and neutrality, what Trisha has said is exactly right, which is what we're going to talk about is what we know because we have seen it, and what we can relate of what we've heard from our patients. And Trisha, where you were in Bangladesh in terms of all of the Rohingya people who came across the border, I mean, we put out a report about that as well, that documented, what kind of medical issues they had, and their stories in terms of what they had undergone across the border, actually without trying to ascribe that to any party in particular. And sometimes, as you can imagine, that is a important but very sort of slight nuance.
Yeah.
There's always a question, Trisha, about how is it that you became a field worker. So maybe we'll use the last couple of minutes and you can talk a little bit about that, and then we'll close off with those are the particular meanings of the principles for each of us. But for people always want to know the process, so please.
The process of my
Yeah.
yeah. Okay. So I actually studied business, which I think is really interesting because I've never actually worked in any sort of like businessy environment. I mean, obviously, their NGOs still operate with the same principles. So yeah, so I have a business background, but for my entire professional career, I've always worked for majority of it, I've been in the not-for-profit sector. And a lot of my experience has been in program management and in community engagement. And so a lot of educational programs, outreach programs, things like that. And so for me, it was quite natural to begin in a position that was essentially public engagement within MSF Canada. I always had an interest in seeing if my skills could be of use in some of our projects abroad. And the health promotion and community engagement position, I think, is one where I find it really fascinating to be able to engage with communities to make sure that MSF really is ensuring that we are keeping communities at the center of our response. And so it was the position that I really learned a lot more about. I think MSF, at least in Canada, and I believe in some other countries, we run sort of information sessions and events like this where you can start to find out a little bit more about the work that MSF is doing. The websites are also great resources, tons and tons of information on there, videos and testimonials from people to understand a bit more about the different positions that exist within the organization. So yeah, that was kind of the route that I took. I just tried to really, really get as much information as I could and participate in events and talk to people so that I could understand a bit more about, how the skills and the experiences that I had could possibly benefit to the work that we were doing.
Yeah, thanks, Trisha. And I think I'll add to that. So, the organization Médecins Sans Frontières, Doctors Without Borders, is not just doctors, although there are a few of us around. And in fact, that there is a lot of different kinds of professional skills that are crucial to being able to do the medical work that we do. So, for example, even for people who have medical skills, it is still not just doctors, but indeed we have many registered nurses, laboratory technicians, epidemiologists, social workers and psychologists. There are a lot of different kinds of professions that go into making our programs work. And I'll say, for me, my trajectory was finishing my medical training. We unfortunately do not take people who are still in their training or who are students. But once I was finished my training and had some professional experience, it was really a question of providing some information about the skills that I have. I'm a generalist. I do a little bit of everything. And MSF is interested in hearing about what kind of professional skills you have, language skills, and of course a certain ability to adapt and roll with the punches, because it can be often difficult to know exactly what's going to happen in a particular place. And then for non-medical people, it's about human resources, administration, logistics, water and sanitation, and project management. I mean, there are really many needs in order to make this whole thing work. Yeah. So I'm going to wrap up. I really thank everybody for being here with us today. We've had people from a lot of places all across the world. I'm really pleased with that. Thanks for your questions. They are super smart and really interesting. We've been talking today about independence, one of our foundational principles, along with neutrality, impartiality, and medical ethics. My name is Dr. Wendy Lai. I'm the president of the board of MSF Canada, Médecins Sans Frontières, Doctors Without Borders. I've been talking with Trisha Khan, who's a field worker and our donor engagement officer for Western Canada. I'm going to ask Trisha if you want to say a couple things about fundraising to wrap up, and then I'm going to make one last comment before we sign off.
Yeah, thanks, Wendy. Just want to say a really big thank you to everyone who joined us here today. Thank you so much for learning more about MSF and the work that MSF does around the world. For those of you who might be supporters, thank you so much for your ongoing support and the trust that you have that enables the work that we do. And if you are interested in supporting MSF financially, you can go to the websites and do that there. Monthly donations are really the oil to our engine, what helps us to be able to plan for what's to come as far as we can see it. And monthly donation of little as $5 or $10 or can go a long way. And so please do reach out if that's something that you have the ability to do. And thank you so much to all of you that already support us. And thanks for having me here today, Wendy.
Thanks, Trisha. Thanks again to all of our viewers. Special thank you to our monthly donors. It is the regularity of that donation that allows us to be as flexible as we are and really kind of carry on in this independent fashion that we've been doing for almost 50 years. We're going to end again with the video that we began on, which describes the principle of independence. I want to say something particular about this, which is the narrator of that video, who you see partway through, is Wayne Leung, who's a colleague and dear friend of all of us who have been involved in putting this together today. He died suddenly exactly a year ago. We miss him dearly. He was an amazing communicator, a great humanitarian, and as I said, a dear friend. And with that, I will sign off.
The work of Doctors Without Borders is guided by three important humanitarian principles: neutrality, impartiality, and independence. But what exactly do we mean when we say our work is neutral, impartial, and independent? Well, being neutral means that we don't take sides in a conflict. We only care about saving lives and alleviating human suffering. Being impartial means helping people according to their medical needs and giving medical care regardless of a person's race, religion, gender, political views, or any other affiliation. And thanks to the support we receive from donors around the world, we can also remain independent. Our independence allows us to reach the people who need our help the most. Living up to these principles is essential to our work. Without these principles, we wouldn't be able to gain the trust and acceptance of all sides in the places where we work. But sometimes living up to our principles is also difficult. For example, during the Rwandan genocide, we made the difficult choice of calling for the military to stop the genocide. This decision made it seem like we were taking sides in the war. In this case, calling for military intervention was a last resort to stop the genocide, despite our principle of neutrality. That's because we will also speak out when we see atrocities against populations or deliberate attacks on people. Just as being impartial is not the same as choosing to be overly accommodating, we will treat anyone who needs medical care, but we will also hold governments accountable to their responsibilities to care for their populations in need. To learn how you can help support neutral, independent, and impartial humanitarian medical care, follow the link in the video description.